My name is Natasha Bowens, and I am an advocacy associate with Campus Progress. We are pleased to host Governor Howard Dean in discussing real healthcare reform today. If for those of you that are not familiar with Campus Progress, we are the youth division of the Center for American Progress, working with young activists and journalists through events, supporting youth-led issue campaigns and publications. We also engage young people on national issues. Right now we have a campaign for economic opportunity for young people, focusing on green jobs, college affordability, and of course, healthcare. So we are thrilled to have Governor Dean here today to discuss healthcare. Governor Howard Dean, former DNC chairman, presidential candidate, six-term governor, and physician, currently works as an independent consultant focusing on the areas of healthcare, early childhood development, and grassroots politics around the world. He began his career in public service in 1982 when he transitioned from a full-time practicing physician to an elected representative in Vermont. Before entering politics, Dean received a medical degree from the Albert Einstein College of Medicine in New York City. And upon completing his residency, he went on to practice internal medicine in Shelburne, Vermont. He is widely credited for reviving the Democratic Party after the 2004 elections, and he most recently was named chairman of the board of the Progressive Book Club, which works to empower progressives to develop, debate, and promote progressive ideas through books. He comes to us today to discuss real healthcare reform, which he outlines in his bold new book, Howard Dean's Prescription for Real Healthcare Reform. Please join me in welcoming Governor Howard Dean.
Thank you very much. I thought I'd talk for a short time, and then the Grand Inquisitor will inquisit, and you will all get to inquisit too. First, a small commercial break. This has been in part sponsored by the Progressive Book Club. The Progressive Book Club is something I'm now the chair of, and it was started to offset what the conservatives have been doing. Books, despite everybody's love for the internet and all kinds of other media, are really the foundation of ideas. It's the one place you get to flesh out at great length kind of the way forward and future vision. So you can download the first chapter of this for free from the Progressive Book Club, and if you want to join it, you should, because they'll throw this in for a good measure. Let me just be brief about this, because we're going to spend a lot of time talking about healthcare. The fundamental tenet of this book is if you don't do real reform, it's not worth doing. And in my view, fiddling with the present system is not real reform. We have kind of run out of gas in the private healthcare system here. We're the last democracy in the world that uses the private healthcare system, and it can't control costs. It does deliver very good healthcare for those who are lucky enough to have insurance. It delivers sometimes too much health care because the incentives are all to do more and to pay more. But the biggest problem is it's incredibly inefficient. There are at least two sectors of the economy where the private sector doesn't do as well as the public sector in terms of efficiency. One is defense, as proved by the Iraq contractors who are getting about 3 times as much money as our GIs are for doing the same thing. And the other is health care. And the reason is the free market doesn't work in health care is because you come to me as a physician, I tell you what you're going to have rather than the other way around, and we both send the bill to the third party. It just doesn't work. There is no curve of supply and demand. And, of course, in 10 years in practice, I never had anybody with acute substernal chest pain get off my table and say, doctor, the guy down the street does it $2,000 cheaper. I'll see you later. It just doesn't work that way. And that's why we spend 70% more money than any other system in the world. And unfortunately, we don't get as good results either in terms of measurable healthcare outcomes as a society. So what to do about it? I believe that the president's plan is the best plan I've seen. I've been doing this since I was your age. When I was a senior in medical school, I got the dean to let me do an elective down here where I followed Senator Javits and Senator Kennedy around, who were trying to put together a universal health care plan for President Carter. It didn't pass, and neither did the Clinton plan, and neither did the Truman plan, and so forth and so on. And the reason it didn't pass, I think President Obama's understood the first reason that it didn't pass, the first president to understand the reason it didn't pass. That is, you can put together a great academic construct of how you think a healthcare plan should be run and what makes sense. But if you don't take into account where we are and where we've been, then politically you can't get it passed. The reason that Britain has a national health insurance plan, which is the most heavily government-oriented plan in the world, although 15% of the dollars do come from the private sector, is because a very conservative prime minister, Winston Churchill, made it happen. And why did he make it happen? Because their healthcare system, along with most of the other healthcare systems in Europe, was destroyed during World War II. In order to allow the British to get healthcare, they basically nationalized what the hospitals that were left and the doctors' practices and paid them salaries where they couldn't make any money and put together the national health system, what ended up as the national health system in the middle of World War II. And after the war was over, people really liked it and said, let's keep the system that we have. Well, we didn't go through that in this country. In fact, the opposite happened. There were wage and price controls because of the extraordinary printing of money that had to take place in order for us to produce enough to win the war. And so the way around the wage and price controls were to give people ever more generous fringe benefits, including health care, and that's how the employer-based system blossomed into what we have. Well, it turned out our system doesn't work so well, and the French and British and German, et cetera, systems work better. And so now we got to deal with that. What the president's plan does, however, is take into account that America is a conservative country with a small c. We always say we want change, but we never quite want as much as we say we want when pollsters ask us. So, and healthcare is an incredibly personal matter. And the healthcare system's like Congress. That is, everybody hates Congress, but they like their congressperson, so they keep re-electing them all the time. Well, people complain about the healthcare system, but they like their doctor, and if they have insurance, they generally like the kind of healthcare they get. And they don't want the government screwing around with it, which is sort of the campaign that Republicans dust off every year. And it's been successful every year except in 1965 when, over the objections of the Republicans, we introduced Medicare. So we've actually had a single-payer system in this country for 45 years. It's called Medicare, and it's for people only people over 65 can get into it. Socialized medicine. There are two groups of people in this country who have socialized medicine. One are people over 65, and the other are all the people who are complaining about Obama's health care plan, that is, the Republicans in Congress. They get sick, they go downstairs, there's no waiting, and they get no bill, and they get taken care of, and no problem for them. How come everybody else can't have it? Well, that's a good question we should ask them. The Obama plan relies on this notion. If you like what you have, you can keep it. If you like your health insurance the way it is, keep it. The government's not going to take anything away from you. In fact, we'll make it easier for you to buy private health insurance if you like. But we are also going to give you a public option. And the reason we're going to give you a public option is it's a lot more efficient. And if you ever want to save costs, it will never happen in the private sector. The truth is the health insurance industry is much better off with what Obama is providing than the only other example of health care run in the private sector, and that's Switzerland and the Netherlands. They have a pretty much all-private universal health care system, and it works because the insurance companies are treated like regulated utilities. The government tells them how much they can make. They give them money if their risk pools need to be adjusted, and they basically run the show, even though it's done in the private sector. Well, I think our health insurance industry is not going to want to do that, and I would advise them to do this, because then all they'd have to do is behave and actually be doing something nice for their customers instead of what they've been doing to their customers for the last 30 years, which isn't very nice and is a word I probably shouldn't use in public, and certainly not with the television cameras in the back. If you like what you have, you can keep it. But if you want a real change for yourself, you can sign up for what your parents and your grandparents have. In most cases here, your parents aren't quite that old yet, but your grandparents have. That is a system that has a 4% overhead as opposed to the 20% overhead that you find in the private system. A system which stays with you wherever you go, which can't reject you when you get sick and can't deny you insurance if you are sick at the time you apply for insurance, which doesn't charge any more if you are sick than it does if you're not sick. That's what Medicare is. And we think that the average American ought to be able to sign up for what people over 65 sign up for. This is not a battle over a private option or a single payer. This is a battle over whether the American people get to choose or whether the insurance industry and the conservatives get to choose because of their ideological reasons or the profit motive. That's what this is about. And this is not a battle between liberals and conservatives or Democrats and Republicans. 72% of the American people want this choice. That doesn't mean they'd all sign up for the public option, but 72% of the American people want the choice. And over 50% of the American people, or the Republicans in America, think they ought to have the choice, not the government. So what this comes down to, as each of these members of Congress votes, is, do you support the private, for-profit health insurance, or do you support the people who sent you to Congress? And that is the core of this vote, and we will be watching. Thanks very much.
Thank you, Governor Dean. And I just want to delve in a little deeper into the brief remarks that Governor Dean just shared with us. First of all, as we all know, our healthcare system is broken. Families are going bankrupt due to medical bills. Young people are going uninsured every day. In fact, young people ages 19 to 34 make up 1/3 of the 47 million uninsured. How did a country so wealthy get to this point? How did we get here? What exactly went wrong?
I think that there's lots of problems, of course. The biggest problem is that there are two conflicting principles in our healthcare system. One is making money for shareholders, and the other is healthcare. And when those principles conflict, something has to give. And so unlike publicly run healthcare plans, an enormous amount of money is siphoned off and out of the healthcare system because private health insurance has a duty to its shareholders, not just to its customers. And that means that there is no incentive to make sure that everybody has health insurance. That's not on the list of how to make money. One of the most extraordinary pieces of testimony about 2 weeks ago was from a former insurance company executive who testified that over the last 3 years, the three largest health insurance companies in America had kicked 20,000 people off their rolls because they'd gotten so sick. Using fine print, it was legal. They put fine print in the contract that nobody notices, and they kicked them off their rolls. And they saved and made for themselves $300 million in profit by kicking those 20,000 people off the rolls after they become sick. So we don't really have any health insurance in this company. What we have is a shell game of the kind that was going on Wall Street for the last 10 years, where private companies get to play games by insuring people who are not too sick and making sure they have ways out. We don't have a healthcare system in the financing system in this country. What we have is a way of making lots of money and making sure that people who get really sick don't get covered and aren't losses. That's awful. The other big problem is fee-for-service medicine. One of the most interesting things that I saw, I applaud these states that are doing all these different things and trying things, and ours certainly did. When we have universal health care for people under 18, which we did when I was governor. And I think Massachusetts gets some credit, although they didn't put in a public option, which they're now paying for because, of course, their costs are out of control. But they have the lowest uninsured rate in the country by far, somewhere between 2 and 4.5%, depending on who you. But that's less than half of the next best states, which are all hovering around 9 or 10%, and it's much better than, say, a state like Texas, which is, I think, 25% uninsured. So they get a lot of credit. However, their costs are so badly out of control that a panel, which included hospitals and doctors, voted to get rid of fee-for-service medicine in Massachusetts. And why is that? Because fee-for-service medicine makes the system incredibly inefficient. We get paid for doing stuff that probably doesn't need to be done. And I don't think any higher percentage of doctors are crooks than insurance agents or cops or anybody else. I mean, there's always a percentage of bad apples, and it's pretty small. But if it's a judgment call, if it's a 50-50 call about whether you need another procedure or not, and somebody else is paying the bill, why not do it? And that's what happens in our system.
It's true. Our doctors are rewarded for the quantity of care that they're providing, not the quality of care. I just recently read an article in the New Yorker by Dr. Gawande, and he raised this argument of the reason our healthcare system is so outrageously expensive is maybe we're having too many procedures, too many tests.
We are. We do 3 times as many coronary artery bypass grafts for the layman, that's open heart surgery, quote unquote, as they do in Canada, and our mortality from heart disease adjusted demographically is not different. And Atul Gawande's article is a must-read for anybody who cares at all about healthcare. It's one of the best articles I've read in the last 20 years. It's in the New Yorker a couple of weeks ago, 2 or 3 weeks ago. Atul Gawande is a public health physician at Harvard who's been in the field for 30 years. I've been reading his stuff. And it's always very good, but this is just incredibly good. And it talks us about McAllen, Texas, where the Medicare costs are 3 times higher than they are elsewhere, and how that happens to occur. And if anybody's even remotely interested in this, it is a plain English article of real substance that's easy for people who aren't wonks to understand, and I really would recommend it. As I said, it's one of the most important articles I've ever read in terms of letting ordinary people who aren't healthcare geniuses figure out why the system is so out of whack. It was really, really terrific.
And speaking of cost savings, what about this health IT? Is that being talked about right now? How are your thoughts on that? I mean, I personally am shocked when I visit the doctor and my health records are still being scribbled onto paper and put in plastic boxes on the front of my door. What about electronic health records?
Well, I'll tell you, here's the story, and you know, I have some experience with this as governor. In general, the deal with IT is it always takes twice as long, costs twice as much, and has to be done twice. I mean, software vendors often come into new fields and they really don't know much about the field. They think they do. We had to do that with the tax department. The problem with software vendors is hospitals now have gotten the software thing down pretty well, and they're doing a good job for the most part. But they never seem to ask doctors and hospitals what they really need. And so they've become more of a pain in the butt than and you know, if you have no time and you're already being told by your employer that you can only spend 6 minutes with a patient when you should be spending 15, your first port of call is not to make sure the IT system works. And that's why physicians and nurses are so incredibly resistant to IT. So I think IT is a good thing, and I think it's important, and I think it will make things more efficient. But right now, I think doctors and nurses around the country are not prepared for it, and the software industry is more focused on getting the job done quickly and making their money than they are educating the people who are going to be using the system. It will happen. And physicians and nurses will be educated, but it's going to be a very, very painful process, and it's not going to be so great for the patient because it's not going to be so great for the provider. But it will happen, and it's a good thing, and we should do it.
So here we are. Healthcare is at the forefront of the debate right now. Obama is gung-ho for pushing for healthcare reform to be completed by the end of this month before the August recess. One of the Senate committees has already passed their legislation. 2 of the House committees have already passed their legislation. What's your assessment of the state of the legislation right now?
I think it's in pretty good shape. I know the media is sort of going through this, we hate Obama and we can't wait to take him down phase, which they do. I mean, well, they are. I mean, it's ridiculous. Last week was the best week for health care reform that they've had, and this week all the media stories are, oh my God, here are the Republican talking points, and you should believe every one of them. Things are never as bad as they seem, and they're never as good as they seem, and it's why people pay more attention to the internet and Jon Stewart than they do to the mainstream media, because there's a lot more accuracy. But the truth is, we're doing pretty well. The bill has passed 3 committees of reference that matter, and they all passed something pretty close to Obama's bill, first of all. Secondly, 2 things that haven't been written about, which I think are, one is cute and the other is incredibly earth-shaking. The cute one is Harry and Louise are out with a new ad. This time they're in favor of Obama's health care plan, as opposed to against the government health care plan. But the more important one is the American Medical Association, which is one of the most conservative groups that's involved in health care reform, just endorsed Henry Waxman's version of health care reform, including the public option. And that is sort of a testament to how providers have been treated by the private health insurance industry over the last 15 years. Over the last 15 years, the idea of the Medical Association, AMA, endorsing anything to do with the public option was crazy. They fought Medicare tooth and nail, including hiring Ronald Reagan to tell everybody that we couldn't recognize our country if we ever adopted this horrible socialist plan. Well, 45 years later, I think we recognize the country pretty well. So that's really an earthquake. And what's happened is, of course, most primary care doctors are now in favor of a single payer, leave alone a public option.
So what do you think made them hop the fence, AMA?
Look, it's not that Medicare's gotten so much better. It's that living in a world with private insurance has become a disaster for most Americans. And you know, even though you get good health care for, 65% of the people get good health care. But the problem is it's so expensive that it's not only so expensive that it's tough on the people who have health insurance because of co-payments and all that, it's killing the country. Health care has become a job crusher. We're losing jobs to Canada, leave alone China, because our businesses have to pay for health care and it goes up 2 or 3 times the rate of inflation. And in Canada, the business pay more taxes in order to have the government pay for health care, but the taxes don't go up at 2 and 3 times the rate of inflation. We've finally reached the breaking point where we're losing our jobs and losing our economy because of the health care mess, and it has to be fixed. And I commend President Obama for taking it on. I think he's doing the right thing. But we need real reform, not fake reform, not the kind of timid reform that some of the people in Congress are talking about. Co-ops and trigger mechanisms are not real reform. So if you're going to do that, don't. I can show you how to do insurance reform that won't cost you any money. Let's not spend $600 billion of our money doing something that's not real reform.
I'm glad you raised the issue of the taxing, and we'll get back to that. But let's go further into what is real reform. You said in your book, we can't pass reform unless it's a public option. It won't be worth the $1 trillion.
Right. Well, actually,
what should a public
it was
option
$1 trillion,
look
and
like?
I know Fox says it's $1.5 trillion, but they're not known for their accuracy in the media. But it's actually $600 billion is what the CBO scored the House bill, which is the most comprehensive at.
Although now the CBO is coming out and saying that the bill is actually not going to reduce costs.
Well, that's a legitimate thing to say. Look, I have great faith in the CBO, and the Republicans go after the CBO when they don't like it, and the Democrats go after the CBO when they don't like it. It's pretty nonpartisan, and probably there aren't enough cost controls in the bill, so let's put some more in. I think that's a reasonable thing to do.
Definitely. So in your brief, you mentioned how we compare with other industrialized nations. Now, the conservatives are not only pushing back about the cost of this reform, about the public option, but they're using fear-mongering to try to make us think we're going to turn into France. Is it really so bad over there? How do we compare?
Turn into France? We'd be so lucky as to turn into France. France is the highest-rated healthcare system by its own citizens of any system in the entire world. So funny that you should pick France. That's the #1 system. That is the country with the highest satisfaction in healthcare. Look, I go all over the world. I travel a lot. I see a lot of Americans that live in Europe. They think the European system is much better than ours because their kids don't get hassled. They have autism. They don't have some bean counter in some private insurance company trying to kick their kid and their family off health insurance. Same with all these other things, diabetes, congestive heart failure. They have a real healthcare system over there, not run by a bunch of people who are more interested in their bottom line and their quarterly profits than they are in the healthcare of their clients. That's why the public option is so important. First of all, it's more important because it's efficient. Second of all, it's more important because it is comprehensive and integrated, so you can actually, most places you can't save money by doing promotion because the people who save the money are not the same people who invested it. And most importantly, the CBO actually says that only a small number, I think 5 or 6 million people, will end up in the public system initially. The reason we need a public system is we have got to show Americans that there's a better way than signing up for these health insurance companies that are doing these terrible things. There is a system that will follow you wherever you go, whether you have a job or whether you don't, or whether you move across state lines. There is a system that's only costs 4% in overhead and not 20%. There is a system that doesn't kick you out if you get sick. There is a system that lets everybody in. That's the public option. And what that's going to force, the insurance, the healthcare people or the right-wingers are saying, oh, they're going to push the health insurance businesses out of business. Not true. They're going to force them to behave as they should to serve their clients better, or they will go out of business. And if they don't change, then they should go out of business because they are not serving the American people the way they ought to be served. They are serving their investors first and the people who buy their health insurance premiums, pay their health insurance premiums second. And they need to put more emphasis on how they serve the American people. And the public option will do that, and I think that I agree with the President, that will force the insurance companies to behave better and treat their customers better, and then we'll have a hybrid system. And I think there's nothing wrong with that. Actually, there's actually technically no such thing as a single payer. A single payer means that everybody's in the same system. Even in Britain, which is the highest penetration of public dollars in the system of any Western industrialized democracy, 15% of all the dollars are private dollars. In the Netherlands, it's higher than that. In Germany, it's higher than that. So whatever system we have is going to be a hybrid. I don't begrudge the private sector for making money. What I do begrudge is them indulging in practices that are bad for their customers, and that's what they've been allowed to get away with.
So how confident are you that we will have the public option in this legislation, especially with the very close timeline approaching? I mean, a lot of people are saying that we could just reform the insurance industry, like you just said, make sure they're not denying care.
That's better than nothing, but that's not reform. And it's not going to save America, the American economy, and save our jobs. I mean, that will make it easier for people to get health insurance, and it won't cost us any money. But it certainly isn't going to do anything for the people who don't have any insurance, and it certainly isn't going to do anything to keep American jobs in America, as opposed to sending some to countries like France where the businesses aren't crippled by these enormous increases in health care every year.
Now, we just have a few more minutes before I open up the questions to the audience. And I was just reading the other day an article in the Huffington Post. They call you a shill for the biotech industry. Any comments on that?
Yeah, absolutely. I'm definitely a shill for the biotech. No, I just was part of an effort to make sure that the biotech industry got a patent life that was longer than what some of the people in Congress wanted to do. And I worked for a law firm part-time that got paid for that, so therefore I was a shill for the bio industry. I'm actually not a shill for the bio industry. My long-term belief is that in order to have a healthy, innovative industry, pharmaceutical or biotech industry, you have to allow them to make some money. I don't think there's anything wrong with making money. I just think there's something wrong with making money at other people's expenses. So the argument that this is a very complicated argument, the article is a very short article, but their insinuation was that since I work for a law firm that represents a biotech group, that I had sold my soul. My actually soul was with this issue in a long time. There has to be intellectual property protection. If there isn't, innovation stops. The reason there's not much innovation in Europe is because because they can't recoup their investment, not because of patent protection, but because of regulation on prices. And some reasonable pricing regulation and some legislation to make sure generics can come in and cut the price at some point is a very good thing, because we want that lower price, and we want these drugs to be available at a cheap price. But there is an argument about where the break-even point is. Biotech is the industry of the future. It pays 3 times as much in wages to people as the average industry does, and it's our cutting-edge industry. If we lose that to other countries because we don't have adequate patent protection, then we've lost a huge segment of the American economy and all the innovation. So my argument was, I took sides in the issue, and there were some lawmakers, including most of these companies, incidentally, are run by Democrats because they're very smart people and they're scientists, and the rest of it I won't finish the sentence. So the argument was, how long should their patents last? And I thought they should last longer, in keeping more with what the bio industry thought, and other people thought they should last shorter. My argument is there's some number that's the right number. I don't know. I argued for 14 years. The industry said 12, and the folks in some Congress people said 0. But you explain to me why you would. First of all, only 1 out of 5,000 compounds they invent they don't invent them. They take them from living things, proteins and so forth. Only 1 out of 5,000 compounds gets to the market. So why would you put any money into something if you had no protection? Somebody could come in and copy your invention as soon as it was proved that it worked. So, look, I think there's a lot of legitimate debate about what the right number is, and I'm not sure that I have it. But I know a lot about this, and I've been doing this for 20 years. And as a physician, I chose to side with the bio industry. I don't think that makes me a shill, but it does make me stand up for a position that's not always popular with some other sectors of the debate. And there's room for debate among these things. Probably more Republicans agree with me on this issue than Democrats. That's going to happen sometimes.
Well, thank you for that. And we can open it up to questions in the audience. If anyone would like to have a question, you can come see Rosie here at the microphone. And we'll also be taking questions from the internet. So if you just want to line up the microphone if you have a question. Hi.
First off, Governor Dean, thank you so much for coming today. My question's about the political realities of healthcare reform and passage in the Senate, and you and others have talked about using the reconciliation process to pass healthcare if they can't get to 60 votes. And there's also been talk of the reconciliation process because the rules around it means that we wouldn't be able to necessarily pass complete reform, but various provisions could get stripped out. So my question is, what would be enough? What type of reform is worth passing and what isn't?
Any reform without a public option is not worth passing, because there'll be no cost controls of any kind, and there'll be no real insurance reform. I think we should use reconciliation because the Republicans, frankly, aren't interested in passing a bill, let alone any kind of reform. They believe, as Jim DeMint said yesterday, that they got to kill health care reform to make Obama look bad. That's what he said. He said, we can knock off Obama's presidency. And I forgot the word he used, but basically it'll be his Waterloo. That's what it is, if we can kill healthcare reform. Well, with that as the motivation for the Republicans, why do we need them on the bill? We got 51 votes for a decent healthcare reform bill of Democrats. There'll be 6 or 8 that don't vote with us. But we got 51 votes. This bill, reconciliation has been, we used 23 times for major pieces of reform. It's been vetoed 3 times. 20 times the reform became law. Look, real reform is tough because, as I said, America is a conservative country with a small c. There's always people who think the change is coming too fast. The real agenda, of course, is not to have any change, or in the Republicans' case, to go back to the 1850s if at all possible. So, I think bipartisanship is wonderful, but if one side doesn't want to be bipartisan, why bother? Why not just pass a good bill? Because if the Republicans, this is about the American people. This is not about the Democrats or the Republicans or even President Obama. Let's do what's right for the American people for a change, and who cares if we have to do it through reconciliation or not. Now, if it's good reform, it doesn't matter that it only lasts for 5 years. If it's good reform, guess what? It's going to be like Medicare. Who would dare to try? We saw what happened when Bush tried to get rid of Social Security. The public ate his lunch, and I'd like to see the Republicans try to get rid of Medicare. Not that they wouldn't like to, because none of them supported it before. They all voted, of course, for the bill as it came out, but they did everything they could to kill it before it came out. And so, if it passes with 51 Democratic votes, it'll be signed by the president. It'll be a very good bill, most likely, and the public will like it. And then 5 years from now, it'll be a dead issue. We have to overcome the politics of the moment to do what's right for the American people. And if we have to do it through reconciliation, we should do it. And it's getting to that time.
Thank you.
Thank you so much for being here. My question is about fee-for-service. You pointed to it as one of the major inefficiencies, and it exists to some degree in Medicare and Medicaid. So my question is, would the new public option exclude fee-for-service as a service providing system?
I don't think it will, although I think ultimately we have to get there. The best healthcare system in America that I know of is Kaiser. And the reason is that Kaiser is an insurance company and a provider at the same time. Its physicians are almost all on salaries. The reason it's so good is because, I'll give you an example. I was in San Diego not long ago, and San Diego is a high-tech center. A doctor there has invented essentially electronic Band-Aid that you can put on somebody with a couple of chronic diseases, and they can monitor your chronic disease, whether it's heart failure, diabetes. Over Wi-Fi, you can get instantaneous printouts like somebody's on a hospital monitor the whole time. You can tell long before somebody's sick enough to come to the doctor's office when they're starting to go out of whack, which means you can prevent intensive care visits, which happens in older people with chronic illnesses. Let's say an ICU visit is $40,000 over a couple of days. So a $3,000 invention in a monitor with Wi-Fi saves, let's say, 2 ICU visits a year. Most people will never make the $3,000 investment because they're not the one that sees the $80,000 payoff, but Kaiser will. So there are private sector models that we can use. Kaiser happens to be a nonprofit. Private sector models that we ought to use, and Medicare is not one of them. It's one of the reasons I don't think it's so terrible to have private health insurance companies that existed. I just wish they didn't behave the way they behave today. But having them in the system is not bad because you get lots of different kinds of innovation, and eventually we find ways to move away from fee-for-service. The Veterans Administration, for example, is a very good system. It's not perfect. There's bureaucracy. There's things that go wrong, just as there are in private hospitals. But I think that we do need to find a way to move away from that over time. This bill doesn't do that, but ultimately it's going to have to. And I think maybe in places like states and like other companies are going to find ways to do it.
Can I ask a quick follow-up?
It's up to you. That's up to the moderator.
Sure.
Why don't the bills that are floating around include, just partial capitation schemes or managed care?
When you pass a bill, the likelihood of it passing depends on how many enemies you want to make. The more complicated the bill and the more people you involve doing things that are different, the more enemies you make. It appears that all 40 of the Republican senators are already enemies of reform, so now you only got 10 left you can work with. So I think the bill is not as comprehensive as it could be, frankly, because the Republicans are not the least bit interested in reform. That leaves us 60 people, and we've got to get 51 votes out of that 60 people.
Thank you.
Thanks. I'm just going to switch it up and ask a question from one of our internet viewers. The Atul Gawande article that you referenced states that the debate over a public option misses the main issue and that cutting costs is more important. Do you agree?
Well, no. And I'll tell you why. I don't think it's possible ever to cut costs without a public option. I think without the public option, there will be no cost cutting. If we've seen the exact opposite, look, we've had a private sector healthcare system for more than 60 years in this country. The costs have gone up so much faster than every place else in the world. I mean, how we can be so arrogant as to think that we have the system when our system has terrible numbers. We're 17th in the world in terms of mortality and morbidity and so forth and outcomes. We charge our citizens 70% more than the next country, and yet the Republicans are up there arguing that if we do this, we might end up like Britain. You know, if we ended up like Britain, we'd be healthier. I mean, look, I'm not defending the British system. There's some things I wouldn't want over here. We're not going to have the British system. We're going to have an American system, which is what they're busy designing. But how about somebody getting with the program? There got to be some Republicans that really are thoughtful human beings that want a real change. I believe there are some. I know, I've met them. Where are they? Where are they in this debate? This can't be about making Barack Obama look bad. Let's get together and make this thing pass and get something done that's right. But the public option is absolutely essential. Because you cannot, one of the things that happens in Washington, and both parties do this, is they keep expecting that if they do the same thing, there's going to somehow be fundamental change. If you do the same thing, you're going to get the same result. So that was the problem I ran into when I became a DNC chair. Everybody wanted to keep doing what we were doing. Well, if we'd been doing that, we'd have President McCain right now and a Republican majority in the Senate and the House, and we certainly wouldn't be talking about health care reform. Right. So if you want to try something different, you got to get a different result. You got to try something different. I think the public option is the most palatable thing that we can do that's real reform.
And the cost will just come with that.
And eventually, look, Medicare's costs are about 2% above the rate of inflation. That's higher than it should be. But the private sector's costs are 2.5 times the rate of inflation. So just by having a public option, you've already started with cost control. We're not going to get to cost control unless you do a public option. It's not going to happen. But I agree with Atul Gawande. The real nut is getting to cost control. Right. But you can't get there without a public option.
Thank you.
Hi. Peter Singer recently had an article out in the New York Times that basically said in any system where you have a limited amount of money, rationing is required. That, you know, if there's $1 million, you might have to deny care to a person whose lifespan might be increased by a month and give that $1 million care to a person whose lifespan might be increased by like 20 or 30 years. So I'm wondering, what role do you think rationing will play in the public system, and who will decide when to give care and when to deny care?
Well, first of all, because we spend 70% more than the next most expensive nation, that is an unnecessary discussion to have right now. There is so much inefficiency in our system. There are some insurance companies that take 50% of every premium dollar and put it in non-health care. Now, that's an unusual thing, but the average is 20% in the private sector. So there's a hell of a lot of money out there that we shouldn't have to even have this discussion. In theory, you can have a discussion about rationing, but in this country, there's not going to be anything close to rationing. In fact, there's more rationing in the system today than there would be under Obama's bill, because today we ration by price. If you don't have insurance, you can't get health care. And then, of course, you end up going to an emergency room and getting not such great health care because it's temporary. So, you know, in theory, the way the British handle this, because they really do have a tight system, their costs are a little less than half of ours. The way they handle it is they have 158 global budgets in regional areas, and there's a council of citizens that get appointed and elected and so forth, and they have that discussion. And Oregon had that discussion thanks to John Kitzhaber, a governor who's also a physician who was governor out there in the 90s. So we can have that discussion, but it's not going to happen in America for a long time because there's so much waste in our system that just getting rid of the waste alone will pretty much let us have most everything we need.
Thank you. Any other questions?
Yes. Hi, thank you. I've seen a couple of studies and some reports that say that a significant portion of the costs for the public health insurance is the administrative costs, presumably from having to comb through every single claim and then figure out who can be denied. So I was wondering, what do you foresee the impact of either a public option or this new reformed healthcare system that we're going for? What do you foresee the impact on that administrative cost aspect being?
Well, actually, administrative costs in public systems are much lower than they are in private systems. The administrative cost in Medicare is 4%. The administrative cost in the best nonprofit health insurance is 12%, and in a for-profit, the minimum is not 20%. So the more people are in the public option, the cheaper our health care bill is going to be, because what they, Medicare, for example, processes a billion claims a year. It's all the same claim form. The guy that runs it probably makes between $150,000 and $200,000 a year. The guys that run United Healthcare and those people make $20 million a year. There's no advertising. There's no return on equity that you have to give investors. So the inefficiency in the private sector is enormous compared to the inefficiency in the public sector. Now, there is inefficiency in the public sector. It's not enough auditing. There is waste, fraud, and abuse. Of course, there's waste, fraud, and abuse on the private side, but there's some on the public side too, and we could do a better job with that. But as far as administrative costs go, it is far lower in the public side than it is in the private side.
Thanks.
Good afternoon, Governor Dean. Like the people who spoke before me, I also am concerned about the administrative costs and the overhead. 4% of Medicare money is overhead, and 30% is, or 15%, 20% would be going not towards healthcare. I was wondering, this sounds kind of extreme, but would it ever be politically feasible to eliminate or abolish the HMO system?
Well, you mean the fee-for-service private health insurance? Because HMOs, actually HMOs used to be a great invention until they became publicly traded. And then they had to watch their quarterly reports, and the investors expect their profits to go up every quarter. I practiced under an HMO that was nonprofit when I was towards the end of my medical practice. It was great. I loved it. I made a little less money per patient, but I got a regular check. I didn't have to send out bills. I didn't have to worry about talking to people on the phone and whether that was detracting from my ability to make money so I could pay the nursing staff and so forth. So HMOs in and of themselves are not bad. It's for-profit HMOs that have given HMOs a terrible name. That's when the bureaucrats came in and started denying people care in order to fatten up the quarterly earnings. But HMOs are not fee-for-service, and that's why before they became publicly held, they were actually a pretty efficient way of dealing with health care. But again, as you point out, the administrative overhead is much higher in private health insurance and publicly traded companies because they have administration, advertising, very high salaries, and return on equity, all of which they have to worry about. You don't have to worry about any of those things except for administration in a big public system. And do I think that private health insurance will be forced out of business? Only if they refuse to change. If you put up a public health care option and let the people choose, they'll vote with their feet. And what will happen, I believe, is that the private health insurance industry will improve itself dramatically and make itself much more consumer friendly in order to stay in business. That's not a bad outcome. I'm not ideological about this. I don't have an ideological belief that we have to have a single payer no matter what. I really don't care. What I want is a decent system that treats human beings well and is reasonably priced and includes everybody. We cannot have such a system unless there's a public option because the private health insurance will never get there.
Speaking of the single payer, I just would like to ask this question from the internet from Sandra. Why is Congress so opposed to single payer? Do they want to protect the insurance companies' profits?
I think they're mostly afraid of it rather than opposed to it. I mean, some, of course, want to protect the insurance companies' profits. But we're going to find out just who they are when we have a vote on the public option.
I think we already know some of them.
Yes, well, we'll find out who they all are. But I think a lot of people are just afraid of the change. And the other problem is this. I talked in my talk before we started this, is the argument here is not whether we're going to have a single payer or whether we're going to have a private sector. That's why I like Obama's bill so much. The argument about is who gets to choose. We're going to let bureaucrats and Congress people and health insurance companies choose, or employers, or are we going to let the ordinary American citizen make that choice for themselves? So let them choose. But if you're going to argue that Americans should get a choice and let them choose whether they want to be in a single payer or whether they want to, like Medicare, or whether they want to continue the system they have, if you're going to make that argument, then how can you turn around and say, well, no, we're going to put everybody in a single payer and take away their choice? So, we can't use the choice argument if you're going to say everybody has to be in a single payer. Now, would a single payer be more efficient? Yes. I don't consider myself a vehement single-payer advocate. But the reason I know that is because when I was governor, we farmed out Medicaid to be managed by a not-for-profit private health insurer for 3 years. Their costs were 3 times as high as it cost us to run the program. And so we took it back after the 3-year contract was up and managed it. So no one can disagree that the single payer is more efficient. But it's a big change, and Americans don't want to be told what to do anymore. They don't want to be told by Republicans that they can't have a public option, but I don't think they want to be told by the Democrats that they can't have a private option. Let them choose. There is a private option that exists in every country that has universal health care. So why should this one be different?
Okay.
Hi, Governor Dean. And well, when Obama was speaking to the American Medical Association, he was touching upon every single progressive issue, and he was getting a lot of cheers, except for one, medical malpractice.
Mm-hmm.
As a physician yourself, knowing the headaches and the hang-ups that medical malpractice can cause, what's your take on what we should do with medical malpractice?
Well, I can tell you why we're not doing much with it, and then I'll tell you what I think we should do. We're not doing much with it because of what I said before to a previous questioner is the more you change, the more enemies you take on, and I think we've got to reform the healthcare system, and do we want to add to our list of people who are trying to undo us the trial bar? I don't think we probably want to do that. In some states it's not an issue. In some states it's a really big issue. In a lot of specialties it's not an issue. In some specialties it's a huge issue. OB, neurology, anesthesia, or neurosurgery and anesthesia, these are really important. I mean, people are not getting served in Florida right now in OB because the malpractice situation the premiums are so outrageous. And then, of course, there's always the role of insurance companies. Everybody wants to blame the lawyers. What about the insurance companies who fiddle around when their investments go down? They charge more because their stream of income is investments plus premiums, and if the investments go down, they just charge more for the premiums. Here's what we should do. There are frivolous suits. Good trial lawyers don't issue frivolous suits because they're good enough so they don't have to. Bad trial lawyers know that the insurance companies will pay $20,000 to make a claim go away because it'll cost them more to hire a lawyer themselves. You can get rid of frivolous suits by 2 things. One is comparative effectiveness research, which the conservatives hate for reasons that are not clear to me, other than totally thinking they can run their business without any facts whatsoever, which last president actually did run the country without any facts whatsoever. But comparative effectiveness research basically means what works and what we find out what works and what doesn't, and that'll lead to national practice standards. And I believe that if you've adhered to national practice standards, you should be able to take that before an arbitration board. And the arbitration board shouldn't be binding arbitration because that limits access to a jury, but that verdict of the arbitration board ought to be admissible in a court of law. That will get rid of frivolous lawsuits. And it'll also make the lawsuit business more reasonable. And I think that's a reasonable, both the doctors I know and the lawyers I know can't stand that idea, so it must have some merit to it, sort of splitting down the middle. I think you do need to address it. So far it's been addressed state by state, and the bar says, oh, it shouldn't be addressed federally, it should be addressed state by state. But some of the states that have addressed it have just been draconian. I mean, we do want people to be compensated for harm that's caused to them by hospitals and doctors, and sometimes harm is caused. I don't think we need to have insurance company pay for just a bad result, because sometimes bad results happen and there's nothing you can do about it. But sometimes doctors do terrible things, and they should pay for that, and their insurance companies should pay. And some of these states that have done tort reform are just draconian. They really limit people's ability to make themselves whole. So I think we ought to have a serious conversation about this, and that we ought to come to a moderate, middle-of-the-road point of view. And I think the middle-of-the-road point of view is allow arbitration, don't make it binding, but make the result of the arbitration admissible, and have national practice standards that the arbitrators can use to judge.
Thank you very much.
Hi. Given the 70-something% level of support for a public option and the seeming successes of the public option in other countries, what do you think the motivations of the Republicans are in opposing health reform?
I think the Republicans just want to make Obama look bad, just like Senator DeMint said yesterday. That's their whole purpose. Look, political parties usually try the same thing if it's been successful. It was very successful. Killing health care reform hurt Bill Clinton, and it helped get the Republicans their majority back in 1994. They think it's going to work twice. I think it's different. I think it's a different generation that elected President Obama. I think the politics of hate and destruction is gone. I mean, the Republicans tend to still want to use it, but I think it's not going to be successful. The electorate has changed dramatically. It's a hugely, generational shift took place in this country when Barack Obama was elected by your generation. It's the first time in my life that anybody, the people who voted who were under 35 years old exceeded the number of people who voted who were over 65. You elected them. And I don't think your generation has a lot of patience with this kind of politics. It worked for the older generation. It's not going to work for the younger generation. So, let's see what happens. I don't think they will kill health care reform, and I think they'll continue to pay a price for being obstructionist.
Thank you.
Hi, Governor Dean. I am a Kaiser kid, so thanks for the shout out. I'm still alive, so I'm living proof it works.
Well, I hope it's better than still being alive. I mean, that's a pretty low bar for a medical.
My question is, healthcare reform has created some odd bedfellows with the wal-Mart and the AMA. We've spent the last 45 years attacking the AMA for their obstructionist ways to health reform. Do you think this is good in the larger scale of things?
I think it's great.
And is it showing that the bill is maybe a little bit too conservative, or?
No, I think the AMA has changed dramatically over the last 15, 20, 30 years. First of all, doctors hate insurance companies as much as the public does now. And secondly, the AMA has shrunk. It's a shadow of its former self. About 20% of active physicians are members of the AMA, and they're mostly very conservative specialists from the South. Not mostly, but that's disproportionately. So I think the AMA gets that if they want to have a future being the spokespeople for organized medicine, they have to look like organized medicine. And they have to encourage points of view that are more thoughtful and progressive. And I give them full credit for that. That's how organizations change, and I think it's a very good thing. I think Walmart's changed. I mean, look, somebody who I suppose is considered pretty left of center, I think there's some things that they've done that are great, not just medical. First of all, I think these in-store clinics are great. Most doctors would be horrified, but people your age, they don't think the way people my age do. And maybe when you're 40, you'll be going to a conventional doctor's office, but right now, if you can just stop in, like while you're picking up your whatever from Walmart and get your sore throat looked at, hallelujah, and put it on the credit card, I mean, look, whatever it takes to bring better health care to people, I'm willing to do it. They are not nearly perfect, but they have improved their health care for their employees. They got a long way to go, but they've made some real steps. And one of the things I love about them, frankly, is they're leasing their rooftops all over the country to put solar panels on and help the country be a more green place. And when you're the biggest retailer in the country with the biggest rooftops in the country, that's a big deal. So, when somebody does something good, even if you disagree with them, why not say so? It doesn't hurt me to say that Walmart and the AMA have contributed in a positive way to the future of the country. That's how you get more people to contribute to the positiveness of the country. And that's a nice thing about your generation. Your generation is more interested in the result than they are in ideologically choosing side, and you're not afraid to say if somebody does something good. And I'm learning. I can't wait for a Republican in Congress to do something good so I can say, you are great, and thank you so much.
Thank you. And I think we might only have time for one or two more questions. I'm going to switch back to the internet questions here. This one's pretty interesting. Why hasn't the healthcare debate been framed as a civil rights, human rights struggle as opposed to a debate about cost cutting? Wouldn't the former mobilize people more?
No, it doesn't, and that's the sad thing to say. If you have a country where 80% of people have insurance, of those 80%, probably 65% is pretty darn good insurance, and 65% trumps 35% any time in a democracy. It's just like the civil liberties issue. God bless the ACLU for their contrarian points of view, but if you poll on how important the Fourth Amendment is, most people, A, don't know what it is, and B, don't care, because they think it'll never happen to them. And so it's a sad thing to say, but from a political point of view, we tried for a long time to sell health insurance on the basis that it was the moral thing to do for the 20% of us that didn't have any, and it didn't sell. You got to sell it. What's it going to do for everybody? And the truth is that people aren't going to do things that they think are sacrificial to their own family in order to help everybody else. They will be happy to help everybody else, and they don't even mind paying a little more to do it. But they really want to see there's some benefit for them, and that's why cost control and saving jobs is an important way to sell health insurance, not just doing something for the uninsured.
That's a sad truth. I think we do have a couple more minutes, so if you'd like to go ahead.
Governor Dean, thanks a lot for being here. I want to ask you about the politics of this. You mentioned that Republicans are pretty much opposed to any kind of reform, and it seems like they are. On those same lines, it seems like the best hope we have for passing a good bill with a strong public option is to get the Democrats together on this. So I want to ask you what you think it'll take exactly for the Democratic leadership to get the Blue Dogs on board, and also more importantly, senators like Ben Nelson, Mary Landrieu, the ones from Arkansas, Claire McCaskill, people who are more conservative and on the fence.
You know, I don't think that this is up just to the leadership in the House and Senate. This is up to us. How did you all get Obama elected? You went out and knocked on all these doors. You worked so hard. I mean, your generation. You turned out in record numbers. We can't just put this off on the House and the Senate and blame them if it doesn't pass. What about us? Are we talking to our senators? I don't mean just the ones that we know are going to. I mean, if you're in New York, both your senators are going to vote for this, right? What about talking to your relatives from Montana and Nebraska and Indiana and Delaware and places like that? I mean, this is our bill. We had the power to elect a president. We still have the power to control public policy, and I'll close with this. A lot of times when I talk to people your age, I have two members of my own family in your generation. It's an incredible generation. It's actually, because it's a positively oriented generation, much more pragmatic, much less ideological, much less divisive than my generation. The biggest, look, our generation was responsible for enormous changes in the country, and I think they were good changes. Mostly they were human rights changes, civil rights, women's rights, gay rights, so people could stand up and say who they were and be proud of it and not have to think that they were second-class citizens in whatever category they might have fallen. Those are all great things. But then, after the incredible turmoil of the 60s and 70s, the country was exhausted, and so were we. So we took a vacation from politics. You can't do that. The result of vacations from politics are administrations like we just had, where the Constitution itself is put in some jeopardy. You have to always be involved in politics. I don't mean you have to do what you did before the campaign, where everybody slept on the floor for 20 hours a week and worked the rest of the time. But you can never not be involved in politics, even when you have kids and you have jobs. Those are nothing more important than family and career. But you've got to give a few hours a week to politics. It doesn't mean you have to, if you can write checks to your favorite, that's just great. If you can knock on doors, that's all even better. But even if you serve in office, that's great. But being on the library board, or being active in your church, which is going to go down, or your synagogue or your mosque that's going to go and build houses for poor people or someplace in the world, that's all politics. That's all community organizing. Community organizing is politics. Teach for America, whatever it is, when you're involved in the community and trying to organize people. After the election, you don't get a pass. The Obama election was the beginning of the change. It's not the end of the change. This gives us the possibility for change where before there was none. So this isn't just about we're going to blame the people in the House and the Senate if they don't pass it. We've got to push for change now, and you've got to stay active. And you've got to stay on the web, and you've got to keep knocking on doors. We were promised change we can believe in. What I like to say is if we don't get change we can believe in, we'll get some more change. And we'll go out and do that in the 2010 election. But in the meantime, you can influence these folks. These folks listen. Everybody talks about, they're in the pocket of the special interest. There's one thing that's more important than money to a politician, and that's votes. The only reason anybody is ever in the pocket of special interest is we're not talking loud enough. And if you talk loud enough, believe me, they'll be in your pocket because you're the ones that hire them. So we'll close this out by saying, if you want real reform, join the Progressive Book Club and get the book, and you can find out exactly what to do. And get on the web and talk to your relatives from the states or the senators that aren't on board yet, and let them know that you would appreciate it if you had real reform. And it's going to be up to you to change this place. It's not going to be. Look, Washington's the last place in the world that changes. It only changes when you want it to change, and you can make it change, and you just did. Don't quit now. Thanks.
Governor Dean. Thanks to you all for coming. Please be sure to pick up, we have a healthcare package going on this week, campusprogress.org. Our first article on how Obama staffers are now uninsured. You can pick up at the table. Thank you so much for coming. Enjoy. Thank you, Governor Dean.